Good afternoon, everybody. I'm Irina Berger. I'm a co-founder of Northeast Medical Practice.
And I'm Dr. William Berger, founder and physician at Northeast Medical Practice. We are a primary care, weight management, and aesthetic medicine practice located in Great Neck, New York.
Today is a great day for us. Today is exactly 1 year since we opened the doors to public. Northeast Medical Practice was born, and we want to take an opportunity, first of all, to celebrate and express gratitude to everyone who helped us. And secondly, reflect on the year that passed. I mean, some challenges, some wins, and also path forward. Right, so Dr. Berger, I have a first question for you. Have you ever regretted that you went solo and created new Northeast Medical Practice?
So before I answer the question, I just also want to thank you for all of the wonderful contributions that you've made to the practice, all of our family, friends, especially our patients, our colleagues, everybody who has helped us to get to this point today.
Yes, and all our vendors, and also I would like to express a specific gratitude to our local community, especially Great Neck House, because they have been very, very helpful with all of the network events and keeping us abreast and helping us out the way they can.
So to answer your question, no, I have no regrets striking out on my own, leaving employed medicine. Because it's given us such a wonderful opportunity to create the practice that we would like, that we feel offers the best form of medical care to our patients. I get to practice medicine the way that I want to. So no, I have no regrets, despite the challenges and bumps in the road along the way.
It's hard. We have been working 6 days a week. Sometimes it's after business hours, before patients get to work. We work long hours. What keeps you going? What gets you moving?
So it's our mission to help our patients as much as we can, and when we have those wins, it really is rewarding and fulfilling. For example, a patient, young man whom I know you remember, who came to us with diabetes and a weight issue, and as I said, a young man. And between getting him started on some medicines and then employing all of the aspects of our lifestyle medicine portion of the weight management program, and that includes you as a certified health coach, Peter Cummings, our exercise physiologist, and myself, I'm happy to say that we were able to get him off of his diabetes and weight loss medicine, as well as the blood pressure medication, all that I had to start in the beginning of his journey. He was very invested and appreciative of everything we were doing here, and these are the kinds of wins that make me eager to run to the practice every day. And of course, all of the sick patients who have come to us in primary care, whom we've either been able to help immediately, or needed to get them into a specialist whom I trust, or for them to go to the hospital, but for me to keep an eye on what's happening in the hospital and have good outcomes. These are the things that get me out of bed in the morning.
Wonderful. And what about the challenges? If you're reflecting and looking back, what would you say the biggest mistakes or biggest failures that we experienced throughout the year?
So starting any business, of course, has its pitfalls and potential issues. Just all of the budgeting, financing, marketing, everything that I didn't need to deal with when I was an employed physician. Insurance and switching between billers and all of these kinds of things, they created some of our biggest challenges. And so live and learn, and maybe understand things a little deeper, question people a little more thoroughly. But that's one of the great things about this entire endeavor, is that it's a learning process in so many different ways. So yes, a few challenges along the way, but I don't think that can be avoided entirely.
And what would you say the biggest accomplishments?
Well, we've been growing bit by bit. We're still here after 1 year. We just hit our 700th patient, which is great. But just the way we've been able to expand all of the offerings in the practice. So since I'm board certified doubly in internal medicine and obesity medicine, we've been able to grow the weight management program, both from people in our internal medicine primary care clinic, but also people coming from the outside just for weight management. You as a certified health coach, Peter coming on for exercise physiology, and the body composition analysis, this device that we picked up and brought into the office. All of these different aspects that we keep adding to the practice, these are all very exciting.
Yeah, the year flew very, very quickly. It's like the blink of an eye. And if you're thinking about future, right? I mean, what is your goal for the Northeast medical practice? Let's say in 5 years, where do you see our baby grow?
Right, so I would really like to add some additional clinical staff. A dietitian would be really helpful and useful, I think, in the office. And ideally to add another physician or a physician assistant so that we can help more patients and continue to provide the kind of care that I think is so important, with a good amount of time spent with the patient and that personal touch that we've developed here.
Beautiful. Thank you. Thank you, Dr. Berger.
My pleasure, but before we run, I did want to ask you, what do you think were the most fulfilling moments for you in the past year here at Northeast Medical Practice?
First of all, I'm extremely grateful for the opportunity, the fact that I'm working and contributing and really be seeing such a phenomenal results. I mean, first of all, I'm extremely proud that we do not treat our patients just a number or widgets. I mean, we take time and we really practicing patient focus. And we go above and beyond. I'm also extremely happy to see our reviews. I mean, we have about 150 reviews on ZocDoc, and we have 4.9, which is, and they rave about front desk, they rave about the service and your expertise knowledge, which is very honorable. And the second, I mean, on Google, we have about 50 of those, and also 5s. I mean, I'm very excited that we also not only extremely a huge emphasis on patient focus, but also I believe in quality of service we provide. I mean, I heard from patients that there are a lot of clinics they doing compound medication. I mean, we do not work with compound because you have no idea what goes in there, right? And I think you mentioned recently that FDA actually gave the red flag about producing those compounds.
There was a bulletin about potential errors in creation of the compounded medicines, but also a lot of confusion for patients because they need to self-dose. So yeah, that's something that we avoid here. There's a clinical practice guideline from the Obesity Medicine Association that advises against using compounded weight loss medications. So patient safety, of course, is paramount.
Absolutely, and the fact that I have an opportunity to coach patients, and sometimes I see female patients 200, 300 pounds, and girls have low self-esteem. They cannot get out and really date. I mean, it's a really still huge stigma. Not that many people understand that obesity, it's actually disease, and it's not the power of will. It's really a disease, and I'm very happy that people reach out to us and we can help them out, and we see such a significant improvement, especially with holistic program altogether. I mean, with my coaching, with Peter, the exercise physiologist, with you, doing analysis of their blood work and recommending the proper medication, people losing 50, 60, 80 pounds, and it's just extremely, and sometimes I would ask them, would they share testimonials, but people ashamed again because it's a lot of stigma around that. And but we make a huge impact, and just to see how girls changing their wardrobes, getting out there, start dating, and creating families and moving on and really feeling good about themselves. I mean, this is what makes my day, and it's really phenomenal mission. And I really, really happy and grateful for the opportunity to be part of this phenomenal journey.
And I'm very grateful for all of your partnership and motivation and all of the hard work that you put into our little baby here. So, any final thoughts?
Yes, again, want to thank everybody, because we wouldn't be able to be here without our patients and without our local community, and of course without your expertise and dedication. So thank you all, and more to come.
Yes, thanks to everyone. And if you'd like to learn more about our practice, you can reach us on the web at northeastmedicalpractice.com or call the office 516-604-3418. We look forward to seeing you further through this lens, but would love to see you in the office. Until then, take care.
Thank you, everyone. Bye bye.